Hello and good morning, everybody. I hope you guys are having a blessed and a wonderful day. So, today we're going to talk a little bit about depression. So, as I show this video, kind of looks a little dull. The sun's not out, the leaves have fallen, it looks a little just dreary, kind of flat. Okay, so just want to talk a little bit about depression. First of all, people need to know that there are 8 types of depression, right? So these types are like different categories that how we kind of come up with specifics of depressive episodes of how people are feeling or what they're dealing with. Something that is quite common and that is also in the DSM-5 is bipolar disorder. So we'll talk a little bit about that just because it relates to depression. They're almost exactly the same or quite similar. So quickly we'll get on to it. Depression. So have you been feeling like you have no interest in things, no pleasure, anything that you do, nothing seems to excite you? Have you been having excessive weight loss or excessive weight gain, right? So maybe you're eating a lot. Maybe you're not eating at all. You don't have any interest in eating anything, right? Maybe you have feelings of worthlessness, right? Like, oh, what am I here for? What am I doing? What have I accomplished? What have I achieved? Feeling that just low worth, right? Like, what are you doing? What are you contributing, right? Then this is a very important one. Have you been thinking about thoughts of death and dying? Not saying, oh, I'm going to kill myself. Nope, not that drastic. But if you've just been thinking like, what is life worth, right? Well, what good am I here? What will the world be without me? Will they even miss me, right? These are just a few symptoms of commonality between bipolar and depression. But as I said, we're talking about depression. So look into yourself. Just think. Any of these things you can relate to, right? Any of these things you may have been feeling. And if you've ever thought like, I could be depressed, right? All right, join me again. We'll continue to talk about depression, give a couple more symptoms, and then we will talk about what we can do, the possibilities to make us feel better. All right, you guys have a good day. Walk good and be blessed.